some of the statistics she was sharing. I also included a couple of other things in here. One was from after abortion. These are some of the other, basically things, injury to women. One of the things is obviously about that 64% are feeling coerced. 60% have said part of me died, according to a survey of the women who aborted, and obviously that number 10, suicide rates are 6 times higher compared to women who give birth. And there's all of the different journal articles and everything are down below, some as recent as 2005. So there's a lot of data out there, and so you just gotta, I mean, from a nursing perspective, kind of start thinking about what are the ones that when a girl comes up to me that I'm going to give her counsel, because your word's going to be more authoritative now, you know, than just someone just standing there doing the counseling. Your word becomes more authoritative. The next page, actually, I just copied one page for you, but this shows 80% of relationships break up after an abortion. So, and this was from the Medical College of Ohio. They did a study about this, and this was back in 1991. However, it's the most recent study that's really been a really finite study about this. And it's unfortunate that they think, a lot of the girls walking in think that they're gonna continue to be with that person that they thought they're gonna be with. The next page is about there's not been a whole lot of studies done in the United States about infertility. Most of them have been done in Greece and Russia because they have very high abortion rates. But the bottom line is that 45%, that number consistently comes up in all the studies I saw, as the women become, 45% of the infertile women in those countries are from abortion. So, and we've seen it skyrocket here. So that's another, a lot of times that will actually stop some of the girls walking in, and I think from a nursing perspective, this could compromise your future births. You could possibly not be able to get pregnant, or there's a prematurity as well. And then the next one is about infant deaths connected to abortion. That's another key area that we could share from a nursing perspective, that there's low birth rate and then also infant death connected with women who had abortions. And then there's so basically this package, just a few just key areas that when I talked to Mary Ann, she kept on bringing up in a conversation with me, and the things that she shares with some of the young women, and it was helpful. And she feels like it's helpful in her conversation. So that's what I copied for you guys. I mean, this is something that Jeff and I went to a program through Rama International, which is another, it's basically, it's more connected to the Protestant side of the pro-life movement. But this was something I was going to suggest for the nurses to use out there, especially, maybe all the sidewalk counselors, but often we get faced by the fact that someone will come and talk to us, but they're saying, well, I'm going to go ahead and go through with the abortion. And this was interesting because they do this at a pregnancy care center, but I thought it was very effective perhaps for the sidewalk too. And this is kind of really simple. Okay, if you were going to go ahead and go through with an abortion, can you do a couple of things for me? First of all, I want you to make sure that you ask them about all the risks. Whether you are having a medical abortion or whether you are having a surgical abortion, you need to know what the top 3 to 5 risks are. You don't have to take my word for it, but these are the top 3 to 5 things you should be working, and you could have your little spill about it. The other thing is you need to ask who the doctor is. You need to know who the doctor is, because are they going to be able to transfer you to another hospital if something goes down in that clinic that they are not prepared for? This is not a hospital. It's not a surgical center either. So you need to be willing. I think as nurses we could be more credible talking about, you know, if you're going to go ahead and go through an abortion,
well,
but you could do it for the facts too.
This is great. I mean, this goes through a lot of information that at the minimum, you know, if they're going to go ahead and have this, that they
as a nurse, I want you to, and I did this with somebody last Friday, or no, last Thursday, when we had an abortion day. I went through this with him, and I mean, it brought up, when I started talking to this, he started crying, and he was like, I didn't know that she could possibly be hurt. He had brought his cousin to get an abortion, and I was like, you have a right to go in there and hold her hand. Because, you know, as long as she wants you with her, she has a right to have anything that she wants. And you guys need to be suspicious that they don't allow these things. And he was like, wow. I go, she's going through a traumatic experience. Do you not think that she wants a family member with her? And those kind of things were he really took heart to it, and he was very he went in and was with her. Mm-hmm.
These people feel so powerless.
Yeah. I feel like you have some credible ground to stand on. That's what Linda was trying to provide us, is some credible ground from a patient rights perspective, and the language is very similar in Boston at the university system, and then this is the other one, the Alliance for Improvement of Maternal Rights. They have very similar language to what we're trying to do on the side.
That was the one we liked the best, wasn't it?
Yeah, the Boston one's actually the one we liked the best, that Boston one.
Well, what was one that was so well footnoted for legal rights?
On their website, that one is, the Boston one.
Was it? I thought there was one more we found after
Oh,
that
no,
one.
the Texas.
Yes.
The Texas law one, but it won't let you print it, and they don't have any copies up to send us. That one is from, I have the website on that one.
I thought that website was fantastic.
Yeah, and I tried to, this is at texashealthlaw.org.
Yes.
That's the one. texashealthlaw.org is another one. It's called Know Your Rights.
That one I thought was really good.
So there's a PDF of it, but it doesn't allow printing, and then they don't have any more copies of it.
Maybe we can contact them.
I did, multiple times. And she's like, well, that's not on our list of giveaways right now, and you can't buy it. And I'm just like, you have it on your website. I even sent her the link. I was like, this is the one I want.
Send me that link again.
Okay.
And
see
I'll
if
see
you
what
can
I
get
can
it.
do.
Okay.
I don't know that I can do any better. But
Texas, but if you go on texashealthlaw.org,
You want to
on
see
the
that?
left-hand side, there's a thing that says Know Your Rights. And it's, that is the pamphlet that's beautiful. It's got
really
everything.
good.
Yeah, even it talks about mental health and in the back of it, but it had a very good section.
I was just
Very similar words.
I was wondering who their attorneys are. I know some of the health law attorneys, so I was going to see if I could.
So I have a few more of these. This is something that you could, if you feel compelled to hand it out, if you feel like it. The one thing that Jeff was talking about in the back of this is basically you are asking them to get a lot of information from the physician. And this is where Planned Parenthood is probably going to get a little annoying. And where they can get more aggressive. So you just kind of have to decide with the person, how do you want to go about doing it.
And so you know why they want you to get that information to them. Right. I mean,
Yeah.
because that's information on the physician.
Well, I'd sure hope they would ask a question about the doctor before they let a doctor
Well, but and that's why.
go do something to them like that.
So that's why I made this or this, because this also says the same thing. Basically, what is the doctor and what are his or her credentials? Well, those are some of the things that they need to know. I mean, they need to know what the doctor's name on, where else do they practice, do they have, basically could I be transferred somewhere else under their care? And most of the abortionists, they cannot. So I would see, you need to question that. And then also about the ultrasound as well. That's something that we know for a fact that Planned Parenthood recently sent 2 girls
That weren't pregnant.
that weren't
correct?
pregnant. They were about to do abortions on them. They landed here, and Terry, did blood tests and everything. They're not pregnant, but they're both illegals. So they're about to do abortions on them.
Oh,
So we know for a fact that happened. So this should be
They
a
were
confirmation.
illegal citizens? you
Yes.
mean?
Amber, I think this one is absolutely wonderful. Did you read this one at the top? The pregnant patient has the right, prior to the proposed therapy, to be informed not only of the benefits, risks, and hazards of the proposed therapy, but also of known alternative therapy.
Right, that one's and that it said the same thing in the Texas health law too,
Yes.
and about your treatment.
That's exactly.
What consent do
What we're
they have
trying-
to sign when they go in to get an abortion? What type of consent? Do y'all have any legal things where you can get a copy of the Planned Parenthood consent form?
I don't know.
Something to go over to see how they actually word it and how they state it to where because I'm sure before they do this they have to sign.